The subcommittee will come to order. The chair recognizes himself for an opening statement. Today we are considering 6 important bipartisan bills, but for the sake of time I will focus my remarks on H.R. 4771, the Designer Anabolic Steroid Control Act, DASCA, which I introduced with Ranking Member Plone. Today, online, in gyms, even in retail stores, consumers are oftentimes unknowingly purchasing products labeled as dietary supplements that are actually designer anabolic steroids. Anabolic steroids are synthetic forms of testosterone that can be extremely dangerous and are Class 3 controlled substances on the Drug Enforcement Administration's, the DEA, schedule. To skirt the law, however, a number of bad actors are altering the chemical structure of such substances and promoting these designer products for their anabolic effects. DEA needs the tools and authority to protect consumers from these dangerous products, keep up with the criminals, and punish them accordingly. H.R. 4771 does just that by immediately placing 27 known designer anabolic steroids on the list of controlled substances, granting the DEA authority to temporarily schedule new designer steroids on the controlled substances list so that if bad actors develop new variations, these products can be removed from the market immediately while permanent orders are being prepared, and creating new penalties for importing, manufacturing, or distributing these deceptive and dangerous products. DASCA is supported by the American Herbal Products Association, the Consumer Healthcare Products Association, the Council for Responsible Nutrition, the Natural Products Association, and the United Natural Products Alliance. I urge all of my colleagues to support this bill, and I yield back the balance of my time. Now I recognize the gentleman from New Jersey, Mr. Plone, for 3 minutes for his opening statement.
Thank you, Chairman Pitts. Let me say at the onset that I'm very proud of the work of the subcommittee. Over the past Congress, we've certainly had some differences, but you and I, as well as other members of this committee, have reached across the aisle to address a wide array of health issues across our communities. However, I don't think it's any surprise to this subcommittee that I place great value on regular order. Examining the issues we seek to address at hearings is an important component of the work that we do, and it's not a majority versus minority or Democrat versus Republican. Regular order allows members to learn the problems that have led to a bill's introduction, as well as the benefits or consequences its passage holds. And I strongly believe that this is the way our committee should legislate. And that's why I have to object, Mr. Chairman, to my own bill introduced by you and I, the Designer Anabolic Steroid Control Act. The bill would give new authority to the DEA to place designer anabolic steroids on the controlled substance list more quickly and provides them with new tools to respond when new designer anabolic steroids, which are illegal drugs, are falsely marketed as dietary supplements. The industry, DEA, and many other sports organizations support its passage, and this bill is an important step forward. But I have to take issue with the fact that we did not have a hearing on the bill. I think members should have time to examine legislation. We greatly understand the concerns that led to this bill, but the rest of the committee has not had their chance to hear from experts on its substance. In fact, FDA, who has oversight over adulterated and misbranded products, has yet to share its comments on this bill. So I hope that we can assure members here today that any concerns that arise from this bill will be addressed in due time before full committee markup. There are also other bills being marked up today that have had no proper examination either, meaning no hearing. But in the spirit of moving forward, I will not vote against them, but I hope that in the future we can return to regular order and have hearings on any legislation before it's marked up in the subcommittee. I just wanted to take a few minutes to speak about the other bills before us. H.R. 4701, the Vector-Borne Disease Research Accountability and Transparency Act, has unfortunately been a lesson in how not to legislate. My understanding is that House Republicans worked with a segment of the Lyme disease community on the underlying legislation, Members and staff have worked over the past few days to try and make improvements to the bill as introduced that preserve the legislation's goals of advancing research on Lyme disease and other vector-borne illnesses, ensuring continuation of ongoing health and human services efforts on Lyme disease and other tick-borne diseases, and providing additional opportunities for public input. But there's still work left to be done on this bill, including getting input from the Department of HHS and other stakeholders. H.R. 4250, the Sunscreen Innovation Act, introduced by Representative Dingell and Whitfield, addresses a faulty and unpredictable process at the FDA for approving new sunscreen products. And this subcommittee heard testimony, and we did have a hearing on this. H.R. 4290, the Wakefield Act of 2014, introduced by Representative Matheson and King, reauthorized the Emergency Medical Services for Children's program through the next 5 years. Again, a good bill, but no hearing. H.R. 594, the Paul D. Wellstone Muscular Dystrophy Community Advanced Research and Education Amendments by Mr. Burgess and Engel will improve research, surveillance, and education. Again, very good bill, no hearing. The last bill, H.R. 669, the Sudden Unexpected Death and Data Enhancement Awareness Act, which I introduced with Representative King, is also moving forward. Too many families in this country suffer tragic events and have struggled with the process to help find answers. This bill is not everything I wanted to see addressed, but it is a critical step forward, and I look forward to working with my colleagues to ensure its passage. Again, I just want to thank all the staff who, leading up to this markup, have spent countless hours working together to come to consensus on all these bills. In addition, our House Legislative Council has worked just as hard. And lastly, I'd just like to say farewell to one of the Democratic health staff of our subcommittee, Ann Morris-Reed. Ann has been a critical part of our health team, and we're sad to see her go, but wish her the best in her next endeavor. Thank you, Mr. Chairman.
Chair, thanks, gentlemen. Now I recognize the Chairman of the full committee, Mr. Upton, for 3 minutes for his opening statement.
Well, thank you, Mr. Chairman. I just want to say, in the interest of time, I'm going to submit my statement for the record. Yield back.
Chair, thanks, gentlemen. Now recognize the gentleman from California, Mr. Waxman, for 3 minutes for his opening statement.
Thank you, Mr. Chairman, for convening today's markup. I'm pleased that we'll be advancing some important bipartisan public health bills today, although we still have work to do on a few of these bills before that goes to the full committee. I hope we can work those out. I'm supportive of H.R. 594, the Paul D. Wellstone Muscular Dystrophy Community Assistance Research and Education, or MD CARE amendments. H.R. 4290, the Wakefield Act of 2014. H.R. 669, the Sudden Unexpected Death Data Enhancement and Awareness Act. And I want to commend Congressman Engel and Congressman Burgess, Congressman Matheson, and Ranking Member Pallone for their leadership on these bills. H.R. 4701, the Vector-Borne Disease Research, Transparency, and Accountability Act, will reinforce the importance of research on Lyme disease and other vector-borne illnesses and build upon existing HHS activities in this area. I will support the manager's amendment, and Mr. Chairman, I hope I have your commitment to continue working on this bill before it's brought to the full committee. And I'll take your nodding your head in the positive to be an indication that we'll do that. The goal of H.R. 4250, the Sunscreen Innovation Act, is to allow FDA to act more quickly to review marketing applications for new sunscreen ingredients. As a result of FDA's current unwieldy review process, there's an unacceptable backlog of these applications, and that has led to an unnecessary delay. I will not support a bill that sets FDA up for failure by imposing unrealistic timeframes for action or unnecessary requirements. We've engaged in strong bipartisan process to ensure this legislation is successful, but we have work left to do on this, and I look forward to continuing to working with my colleagues. H.R. 4771, the Designer Anabolic Steroid Control Act of 2014, would go a long way toward removing dangerous steroids from the market. We have seen the harms that these drugs have caused, particularly in our youth and in professional sports, particularly baseball. Sports leagues and anti-doping experts support this approach because it would give them an important tool to fight the use of hard-to-detect designer steroids. As this bill moves forward, we need to ensure that it captures all forms of anabolic steroids and there are no loopholes that would prevent DEA from taking strong enforcement action. I support these measures going forward, and I want to join the praise for our staff, Ann Morris Reed, and the great work that she has done, and we are going to miss her. I yield back the balance of my time.
Chair thanks the gentleman. Chair reminds members that pursuant to the committee rules, all members' opening statements will be made part of the record. Are there further opening statements? I recognize Dr. Burgess, 1 minute.
Mr. Chairman, thank you. We are marking up several public health bills today, and I plan to support all of them. I do want to focus my comments on the bipartisan legislation introduced with Mr. Engel, H.R. 594. This bill makes targeted updates and improvements to legislation first passed by this subcommittee in 2001 and then reauthorized in 2008. These efforts have passed both subcommittee and full committee on voice votes and passed overwhelmingly on the floor under suspension, a trend I hope we can continue. This legislation is supported by the totality of the muscular dystrophy community and over 20 organizations. I ask unanimous consent to insert these letters into the record.
Without objection, so ordered.
H.R. 594 has 104 co-sponsors with several members of this committee. I thank the committee for its bipartisan work on these bills and urge all members to support. I yield back.
Chair thanks, gentlemen. Now recognize the gentleman from Michigan, Mr. Dingle, for 1 minute for his opening statement.
I will withhold and get my 5 minutes into the regular course of business in the committee. I thank you for your courtesy.
Chair thanks the gentleman. Chair recognizes Mr. Whitfield, 1 minute for an opening statement.
Thank you, Mr. Chairman, and I just want to thank you for including in this markup a bill that Mr. Dingle and I introduced, the 4250, the Sunscreen Innovation Act. As it has been referenced that FDA has had some very long times to consider various sunscreen applications, one up to 10 years. And unfortunately, skin cancer is very prevalent in this country, and the American public's being denied effective sunscreen products that have been used safely overseas for years. And so I want to thank the Democratic staff working with the Republican staff and the PASS Coalition and the Environmental Working Group that have come close to reaching agreement on this bill as a way to speed up the process and yet still protect the public. And I look forward to working with all the parties as we move forward the full committee, and I would yield back the balance of my time.
Chair thanks, gentlemen. Now recognize the gentleman from New York, Mr. Engel, 1 minute for an opening statement.
Thank you, Mr. Chairman and Mr. Ranking Member. Thank you for convening today's markup. I would like to highlight H.R. 594, the Muscular Dystrophy Community Assistance, Research, and Education Amendments, or the MD CARE Act amendments. As Mr. Burgess mentioned, I partnered with Mr. Burgess to introduce this bill, and in the substitute amendment we will be considering at this markup. I want to thank Representative Burgess for his hard work on this legislation. I would also like to thank Reps. Waxman, Pallone, Pitts, and Upton for bringing this bill before the subcommittee today. Since it was first enacted in 2001, the MD CARE Act has played a critical role in improving the lives of those suffering from all forms of muscular dystrophy. The law is working well. Today's legislation simply serves to update the MD CARE Act, aligning our programs with current scientific achievements. The bill has strong bipartisan support from more than 100 co-sponsors, many of whom are members of this committee, and it has the full backing of the muscular dystrophy community. So I urge all my colleagues to join our bipartisan efforts by supporting the legislation, and I thank the chairman and yield back.
Chair thanks the gentleman. Now recognize the gentleman, Mr. Matheson, 1 minute for an opening statement.
Thanks, Mr. Chairman. I just want to highlight H.R. 4290, the Wakefield Act. This act would authorize the Emergency Medical Services for Children program. This is a program that has been around for 30 years with bipartisan support. At that time, 30 years ago, it was discovered that there wasn't enough focus on that children are different from adults. And with this program in place, emergency care for children has been dramatically improved across our country. This is a program that works. I've talked to the Children's Hospital in my own hometown, the emergency department. They have benefited from the research of this program as well. And so I want to thank you for bringing this up for consideration. I want to thank my colleague, Peter King, for introducing this bill with me. And again, look forward to bipartisan support as we support this legislation. I yield back my time.
Chair thanks the gentleman. I ask for unanimous consent to include the following statements for today's markup record from the Natural Products Association. and a letter on behalf of the trade associations of the dietary supplement industry. Without objection, so ordered. Chair asks unanimous consent that the subcommittee adopt and favorably forward the following bills as described to the full committee. H.R. 4250 with the amendment in the nature of a substitute filed by Mr. Pitts. H.R. 4701 with the amendment in the nature of a substitute filed by Mr. Pitts. H.R. 594 with the amendment in the nature of a substitute filed by Mr. Pitts. H.R. 669 with the amendment in the nature of a substitute filed by Mr. Pitts. And H.R. 4290 with the amendment in the nature of a substitute filed by Mr. Pitts. Without objection, so ordered. The chair calls up H.R. 4771 and asks the clerk to report.
H.R. 4771, to amend the Controlled Substances Act to more effectively regulate anabolic steroids.
Without objection, the first reading of the bill is dispensed with, and the bill will be open for amendment at any point. So ordered. Are there any bipartisan amendments to the bill? Are there any other amendments? The question now occurs on forwarding H.R. 4771 to the full committee. All those in favor say aye. Aye. Opposed, no. The ayes appear to have it. The ayes have it, and the bill is agreed to. Without objection, the staff is authorized to make technical and conforming changes to the legislation considered by the subcommittee today. So ordered. Does that conclude? Without objection, the subcommittee stands adjourned.